how are you?
Good, how are you?
Good. So my name is Amy. I'm going to be the nurse taking care of you today. I'm going to do a head to chest physical exam. Should take me less than 20 minutes. Is now a good time?
Yes.
Great. So if you have any questions, I want you to just stop me and let me know. Okay? So I'm going to pull this curtain for some privacy for us. First things, I want to check your name. So what is your name?
Allison Medelman.
Great. And what's your date of birth?
July 18th, 1986.
Great. Thank you. Can you tell me where you are today?
Chamberlain University.
Great. And what is the month?
It is May.
Good. Do you have any allergies?
No allergies.
Are you in any pain right now?
No pain.
Okay, great, perfect. So my patient is dressed appropriately for the weather. She appears to be well nourished. She's smiling, making eye contact, sitting upright, answering questions very quickly and appropriately. She has no issues with mobility. She was able to get herself up on this bed without any of my help. So my patient is alert and oriented ×3, as evidenced by my questions that I asked her earlier. There we go. So I'm going to go ahead and assess your skin. So looking at my patient's skin, first inspecting, the color is even throughout. The color is appropriate for race. She has a couple of different nevi. Any of these new? Nope. Good. They've been here forever.
Yes.
Good. So her texture is even throughout, and her skin is warm to the touch. I'm going to go ahead and assess capillary refill of her fingertips. Good. Less than 2 seconds. You can go ahead and put your hands down. So I'm going to go ahead and look at your head and your face. My patient's head is symmetrical. Her palpebral fissures are symmetrical. Go ahead and smile for me. Good. Her smile is symmetrical. Her eyebrows are symmetrical. I'm going to go ahead and palpate your lymph nodes. So I'm going to name them as I palpate them. I'm going to touch your face. Pre-auricular, post-auricular, occipital, posterior cervical, tonsillar, submandibular, submental, superficial cervical, deep cervical. I'm going to go ahead and shrug your shoulders. Supraclavicular. Good. So I don't feel any lymph nodes, so that's a normal finding. So the next thing I'm going to do is I'm going to inspect your eyes. I'm going to grab my pen light really quick. So just looking at your external structures, her eyes are symmetrical. Her eyelashes curl up and away and down and away. Her sclera is china white. Her irises are brown. Her pupils are equal and symmetric. I'll go ahead and look up for me. I'm going to pull down. Good. Her conjunctiva is nice and red and pink. Perfect. So what I'm going to have you do is go ahead and follow my pen light without moving your head. Good. So extraocular movements are intact. So cranial nerves 3, 4, and 6 are intact. Go ahead and look straight ahead of me. I'm just going to shine a pen light. Beautiful. Girl. So pupils are equal, round, react to light, and then follow my pen light for me. Good. And accommodation is noted. So now I'm going to go ahead and look inside your ears. So inspecting the external ear, there is no redness, no lesions, no discharge. Any pain when I do this?
Nope.
Good. I'm going to go ahead and look at the other side. No redness, no lesions, no discharge, nothing behind the ear. Any pain when I do this?
No.
Good. Perfect. All right. So the next thing I'm going to do is look at your nose. So your nose is symmetric and even. Any pain when I palpate?
No.
Good. Go ahead and take a deep breath in. Good. Take a deep breath in. Good. So her nostrils are patent on either side. I'm going to have you look up for me. Good. Good. No redness, drainage, or discharge, and her septum is intact. It doesn't appear to be deviated. So now I'm going to grab my lovely tongue blade, and I'm going to inspect your mouth. So good. So her lips are moist and pink, free of lesions. Her teeth are lovely china white. Bite down for me. Good. Any problems with that? Good. Go ahead and open up for me. Good. And I'm looking at the back of my patient's throat. I can see her anterior and posterior pillar, her posterior pharyngeal wall, her buccal mucosa, all her hard palate and her soft palate are smooth, glossy, pink, and intact. I'm going to put this on the front of your tongue. Good. Go ahead and say Beautiful. So uvula rises with phonation. Cranial nerves 9 and 10 are intact. All right, so the next thing I'm going to do is move on to your respiratory system. So the first thing I'm going to do is inspect my patient's chest cavity. So her costal angle is equal to 90 degrees. When I look at her anterior posterior, it is half the diameter of her transverse. I'm going to go ahead and have you just turn to the side for me. I'm going to place my hands at T9, T10 and have her take a deep breath in. Good, beautiful. So symmetrical expansion is bilateral and symmetrical and equal. And then I'm going to place my hand on the back of your chest cavity, and every time I touch you, I want you to say 99.
99, 99, 99, 99, 99, 99, 99, 99.
Good. So symmetric tactile fremitus, symmetric vibrations are felt throughout. You go ahead and turn back to the front for me. All right, so looking at the front of her chest cavity, I'm inspecting and there are no lesions, there are no heaves. I'm going to palpate your chest cavity for any thrills. Good. And then I'm going to go ahead and I'm going to auscultate your anterior and your posterior lungs. You can just stay where you are and just breathe normally for me. I'm going to place my stethoscope under your shirt. Good. So I've auscultated her right anterior and her left anterior upper lobes. I'm going to move to the back in order to auscultate her left upper lobe, her right upper lobe, her left upper lobe, right upper lobe. I'm going to take my stethoscope and place it up the back in order to get your right posterior lobe. Good. And your left posterior lobe. And then can you lift your right arm up for me? Good. I'm going to get that right middle lobe. Good. Clear vesicular lung sounds are heard throughout. So now I'm going to go ahead and look at your neck. And I don't see any pulsations, so no jugular vein distension. When I inspect, I really can't even see a carotid pulse, maybe barely. So I'm going to go ahead and palpate your carotid pulse one at a time. Good. So our carotid pulse is a 2+ bilateral. Inspecting her chest wall, again, I don't see any palpations. I don't see any heaves or any lifts. I already palpated the chest wall before and I didn't feel any thrills. So I'm going to go ahead and auscultate your apical impulse at the 5th intercostal space. Thank you so much. Good. So the apical pulse, regular rate and rhythm. I'm then going to auscultate in the 5 auscultatory areas for cardiovascular. So starting with my diaphragm and then moving to my valve. Aortic, pulmonic, moving down to Erb's point, tricuspid, and then up to mitral. And then I'm going to flip my stethoscope and listen with the bell. Aortic, pulmonic, Erb's point, tricuspid, and then to mitral. All right, so all 5 sounds were heard throughout. No S3, S4, or any murmurs were heard. I could auscultate S1 and S2 in the appropriate locations. I'm going to go ahead and palpate your radial pulse bilateral. Beautiful. 2 pulse, 2+, radial pulse, regular rate and rhythm. Okay, so that's it for today. Do you have any questions for me?
No.
Okay, any pain at this time?
No.
Okay, great. Do you need me to help you off the bed or do you need anything else?
I'm great.
Okay, great. I'm going to go ahead and wash my hands. Thank you so much for today.
Thank you.
All right, thanks. Bye.